Hi, Mr. Johnson. Thank you for coming today. It's a pleasure to have you.
It's a pleasure to be here. How are you?
I'm great. How are you feeling today?
I'm feeling good, but my throat kind of hurts.
Your throat kind of hurts. Would you like a glass of water?
No, I'm fine.
Okay, all right. So I've been reviewing your case history here, and it appears that you're a 55-year-old man who recently had rotator cuff surgery.
Yes.
Yes, okay. And ever since you've had this surgery, you've been having some difficulties with your voice? Yeah. Okay. So I've noticed in the samples you sent over to me that there was a lot of roughness in your voice and some pitch breaks. Yeah? Okay. So your physician and I are in agreement that we think that what's happening to you is that you've developed a granuloma. Do you know what a granuloma is?
No, not really.
Okay. So a granuloma is simply a mass that's caused by inflammation. So what probably happened was after your rotator cuff surgery, when you were intubated, the rubbing against your vocal folds caused irritation, which caused a cyst, which eventually became vascularized and became a granuloma. So if these are your vocal folds here that move when you phonate and speak, it's just like there's a giant mass here. So they're trying to move, but they're inhibited by this mass, okay?
So they can't cooperate that well.
Yeah, they can't cooperate that well, exactly. Now the primary method of treatment for this is surgery to have it removed, but there are several things I can teach you as a speech-language pathologist in order to alleviate some of this roughness and the discomfort that you're feeling from your throat. Okay, so that's going to really be the aim of our treatments, is to alleviate this roughness and to decrease the amount of throat clearing and coughing you experience.
Yeah.
Does that seem like a good course of action?
Yeah.
Okay, great. Let's get started. So the first thing I wanted to talk to you about was something called vocal hygiene, which simply talks about behaviors that maintain good vocal health. Okay? Now there are two reasons I wanted to talk to you about this, and one is because you have such a huge history of acid reflux, and two, because you have a lot of throat clearing happening. Okay? So the first thing we're going to do about acid reflux is we really want to modify your diet. Okay? No spicy foods. Try to minimize the amount of alcohol you intake if possible.
I don't really drink that much alcohol.
You don't drink that much alcohol?
Because I know it will hurt my throat even more, and I want to be good with my consequences.
Oh, perfect. Perfect. That's great to hear. Okay? Now, I understand that you like to eat dinner right before bed. Yeah. So if possible, we want to get you to eat dinner at least an hour before you go to sleep so that when you lay horizontal, the food doesn't regurgitate out of your esophagus and into your larynx here, okay? And if that's not possible, it's always good to just lay down with pillows supporting your back so that you're a little elevated. Is that a good course of action?
Yes.
Okay, now with regard to your throat clearing, one compensatory strategy we can try to use is whenever you feel the need to go ahead and cough, you can just try humming instead. So when you feel the urge coming, try to turn the cough into a successful hum. So that kind of gives you something to do, like your body seems to want, but it's not as traumatic to your vocal folds. Do you have any questions about that?
No, I don't think so.
You don't think so? Okay.
Okay.
So I have now a few other questions. I'm going to ask you if you feel up to it.
I feel up to it. I can do it.
Okay. So how much water do you drink?
Wow. I drink not that much a day, but I still drink a little bit.
Okay, a little bit. So we're definitely going to want to get you to drink more water throughout the day in order to keep your vocal folds and everything hydrated and in good condition, okay?
Okay.
What about smoking? Do you smoke?
No.
Okay, great. That's really good news for your vocal folds. What about misuse and abuse? Is there anything you do at your job that really puts stress on your vocal folds, like yelling?
Yeah, well, sometimes I have to yell to my coworkers. I have to do it a few times because they won't really listen to me because it's a loud place.
Yeah, it's a loud place.
Yeah.
Okay, well, we definitely want to try to minimize your yelling as much as possible. Do you think you can try to work on that?
Yeah.
Okay. That would be definitely very helpful, though I don't know what your work environment is like. Okay? Do you have any more questions for me?
No, not really.
Okay. So next time you feel a cough, do you feel one coming on? We're going to try to transform that into a hum. Okay?
Okay.
How do you feel?
I feel good about this.
How does that feel?
It feels fine.
It feels fine? Okay, that's good to know. The next thing I want to talk to you about, Mr. Johnson, is something called a confidential voice. This is another form of treatment that we can use in order to make it easier for you to speak, and it'll cause you a little less pain. Okay?
Okay.
Okay, great. So the way that I describe this to people is a confidential voice is a way to reduce the vocal loudness and the trauma that you're putting on your vocal folds. Because when you talk loudly, they kind of smack together. But if you talk gently...
Yeah, I get it.
You get it? Okay. So it's just a way for it to not irritate your granuloma. A way of you to speak without irritating your granuloma. So the way I like to describe this to patients is that it's kind of in between a normal voice and a whisper, okay? It's like you're talking, but there's a sleeping baby in the room. Okay? So you're going to try to sound breathy and light, kind of like this.
Okay.
All right?
Okay.
Can you try for me?
Okay.
Breathy.
Breathy like this.
That's perfect. That's really good. Okay. So now can you say Monday, Tuesday, Wednesday, Thursday for me?
So Monday through Thursday.
Yes.
Monday, Tuesday, Thursday.
Great work. That was really good work. You got kind of louder there at the end, but the beginning of the days were excellent, okay? Try it one more time for me.
Monday, Tuesday, Wednesday, Thursday.
Excellent. How does that feel?
Feels good.
It feels good?
Feels gentle.
It feels gentle. Does it feel better than your normal voice?
Yeah, a little bit.
Okay, great. Can you try counting to 5 for me?
1, 2, 3, 4, 5.
A little slower. 1, 2, 3.
1, 2, 3, 4, 5.
Great. Now, just the last thing I'm going to ask you to do is can you tell me about what you had for breakfast this morning?
Well, my wife made me some eggs and bacon with orange juice, and it was really good.
Okay. All right. One more time. Just a little softer.
So, my wife made me eggs and bacon with orange juice, and it was very yummy.
Okay. Thank you for trying so hard. That's really great. Thank you. You're doing really well. So ideally, you would use this voice in all long conversations and conversations that you're having throughout the day, and it's supposed to just really take the pressure off of your vocal folds, okay?
Yeah.
Okay. Okay, Mr. Johnson, the last thing I want to touch on today is some ways that you can take data at home so that we can track your progress as we go through these strategies together.
Okay.
Does that sound like a good plan to you?
Yeah, it does. Yeah.
Great. Okay. So the first, I've made a few of these sheets. I'm going to email them to you and make you a few copies today so that you're going to have them.
Okay.
But let me show you, if you look down here, the first bit here is just a worksheet that has 3 columns. The first column, it says cough, the second one hum, and the third is no response. So if you feel a cough coming on and you cough, you're going to check cough. If you feel a cough coming on and you were able to correctly translate it from a cough to a hum, you're going to check hum. And then if you're able to simply just suppress the cough, you're going to check in this third column here, okay? Does that make sense?
Yes.
What I want? Okay, perfect. So then we'll be able to tally them up and get percentages and see how well your progress is doing throughout the next weeks.
Okay.
Okay, great. Now the next portion is data that we'll be collecting on your use of the confidential voice.
Okay.
And that's something you're going to want to use throughout as many conversations as possible throughout the day. Okay? Okay, so when you have a conversation, I want you to mark what percentage of the conversation you think you used in your regular voice and what percentage of the conversation you think you had in your confidential voice.
Okay.
Does that make sense?
Yeah, it does.
So, for example, the first conversation you have, if it's to order coffee from the barista in the morning, if you think that 20% of that conversation was in your regular voice, but 80% was in that breathy voice that we're looking for, just mark that. Very easy. Okay? And then the last form of data I'm going to have you collect outside is data on your tendency for acid reflux.
Okay.
So just simply after each meal, I want you to write down the meal you had. So like if you had chicken, if you had eggs, you're just going to kind of write down so that we can keep track of what you're eating. And then next to that, I want you to write a plus mark if you end up having an instance of acid reflux.
Okay.
Or a minus mark if you have no instances of acid reflux. And then next to that, I just want you to write the time so that we can keep track of like how late you're doing and if there are any correlations to time or the type of food you're eating and your acid reflux, we can keep track of that.
Okay.
Do you have any questions for me regarding this data sheet that I've made for you? No. Okay, so I'm going to go ahead and email those over to you and make you a few copies now.
Okay.
Okay, it's been great meeting you. All right.